Alright, so today we're going to be doing the anterior drawer test. This is to test your anterior talofibular ligament. So to do that, you're going to put one hand on the posterior calcaneus and one hand on the anterior tibia, and you're going to pull towards you. And you'll know if it's a positive test because the anterior talofibular ligament will be in pain. This will result in a sprain in the anterior talofibular ligament. Alright, so today we're going to be doing the talar tilt test for the anterior talofibular ligament. So to test this, you're going to put one hand on the calcaneus and one hand on the tibia. And while holding the tibia still, you're going to invert the foot. And a positive test will be if there's pain in the lateral malleolus and the anterior talofibular ligament. This will result in a sprain in the anterior talofibular ligament. Alright, so this test is the talar tilt test for the calcaneofibular ligament. To test this, you're going to put one hand on the calcaneus and one hand on the tibia, and it's going to be in a neutral position, and you're going to invert the calcaneus. And it's a positive test if there's pain in the lateral malleolus calcaneofibular ligament. This will result in a sprain of the calcaneofibular ligament. Alright, so this test is the talar tilt test for posterior talofibular ligament. So to test this, you're going to have the foot in a dorsiflex position, one hand on the calcaneus and one hand on the tibia, and you're going to rotate the foot, or invert the foot. And this test will be positive if there's pain in the posterior talofibular ligament, which will result in a sprain of the posterior talofibular ligament. Alright, this is the Kliger test for the deltoid ligament, which is on the medial side of your ankle here. You're going to have the patient hanging their foot off the table in a plantar flexion, and place it on the tibia, and then one hand midfoot, and you're going to rotate it into eversion. And if there's pain in the medial malleolus or the deltoid ligament, then that's a positive test, and it's a sign of a sprain for the anterior talofibular ligament. Alright, so this is part 2 of the Kliger's test, and it's to test for distal ankle syndesmosis. It's done the same way as the other tests, with the patient's foot hanging over the edge of the table, except they're going to be in dorsiflex instead of plantar flex. You're going to put one hand on the midfoot and the other on the tibia, and rotate the foot into eversion. And you're looking for a positive test would be pain in the front of the ankle joint, which would result in a sprain or a high ankle sprain.